Stop scrolling right now. Before you move on, I need you to do something. Right now, without adjusting anything, check your legs. Are they relaxed or do they feel heavy, tight, maybe colder than the rest of your body? Most people never notice this until someone asks, and that's the problem. Because by the time you feel it, something's already been quietly breaking down for months, maybe years. I'm Dr. Megan Foster, and I've worked with thousands of patients dealing with circulation problems and nerve damage over the last 24 years. What I'm about to tell you goes against what most doctors say, and honestly, it might upset you a little, but you need to hear it. Weak, tired legs are not normal aging. That's what everyone gets told. Your doctor says it, your family says it, even you probably believe it. But it's wrong. Age doesn't suddenly shut off your blood flow. Age doesn't cut your nerve signals. Something else does, and almost every single person misses it until it's too late. Think back for a second. There was a time, maybe not that long ago, when standing up didn't require a mental checklist. You didn't think about it, you just stood. Walking felt automatic. Your legs worked. No hesitation. No second guessing your balance. Now maybe you pause before getting up. You walk a little slower, especially at night. Your legs feel less steady, and you've started planning your movements instead of just moving. It's subtle, nothing dramatic. But that contrast, that shift from automatic to cautious, that matters more than you think. Here's what I need you to understand. This wasn't inevitable. Your body didn't just give up on you. Age didn't flip some switch that made everything stop working. What happened was a slow, gradual breakdown in how blood reaches your legs and how your nerves communicate with your muscles. And here's the critical part: that breakdown has specific causes, which means it has specific solutions. Think of your legs like the end of a long supply line. Blood has to leave your heart, travel downward against gravity, push through smaller and smaller vessels, and deliver oxygen and nutrients to muscles and nerves at the very bottom of your body. If those vessels get stiff, if the lining inside them gets damaged, if the insulation around your nerves starts wearing down, then flow slows, signals fade, and muscles weaken. Not because you're old, but because the system isn't getting what it needs to stay maintained. This isn't just theory or guesswork. Major research from Harvard and the National Institutes of Health followed thousands of adults for decades. What they found was eye-opening. People the same age, living in the same conditions, had completely different outcomes. Some maintained strong blood flow to their legs, better nerve responses, faster walking speeds, and significantly lower fall risk. Others didn't. Same age, totally different results. The difference wasn't genetics, it wasn't luck, it was nutrition. Specifically, it was whether their bodies had adequate levels of certain vitamins that directly affect circulation and nerve function. In just a moment, I'm going to walk you through 6 vitamins that have the biggest impact on leg strength and circulation. The number one vitamin on this list is so commonly deficient that correcting it alone has helped people regain warmth in their feet, better balance, and confidence in their legs within weeks. But the order I'm covering these matters because they build on each other. Before we get there, I want to ask you something, and you don't need to explain or justify anything. Have you noticed leg weakness, numbness, or balance issues in the last few years? Just type yes or not yet in the comments. No judgment here. You're not alone. And honestly, seeing those responses helps more people than you realize. Let's start with number 6, vitamin C. Most people think it's only for immunity, for fighting off colds. That's not the full picture. Vitamin C maintains the elasticity of your blood vessels. Without enough of it, those vessels become brittle and less responsive, which directly reduces how much blood reaches your legs. Studies have linked low vitamin C levels to leg fatigue and slower walking speeds. The mistake most people make is assuming that eating some fruit means they're getting enough. But absorption declines as you age, and many people are borderline deficient without realizing it. Here's what happens at the cellular level. Your blood vessels are made of layers. The outer layer provides structure, but the middle layer contains smooth muscle and elastic fibers. Those elastic fibers need vitamin C to stay flexible. When vitamin C is low, new collagen production slows down and the existing elastic fibers start to break down. The vessels lose their ability to expand and contract properly. That means when your leg muscles need more blood during activity, the vessels can't dilate enough to deliver it. You feel that as fatigue, heaviness, or the inability to keep going as long as you used to. There's also an inflammatory component. Low vitamin C allows oxidative stress to damage the vessel walls. That triggers low grade inflammation, which further stiffens the vessels and reduces blood flow. It's a cycle that reinforces itself. The less vitamin C you have, the more damage occurs, and the worse your circulation becomes. People don't connect the dots because it happens slowly over years. They just notice they're more tired, their legs feel weaker, and they assume it's age. The research on this is clear. A study published in the American Journal of Clinical Nutrition tracked older adults for several years and found that those with higher vitamin C intake had significantly better walking speeds and lower rates of mobility decline. Another study showed that people with low vitamin C were more likely to report leg pain and cramping during physical activity. These aren't minor effects. We're talking about real functional differences in how people move and live their lives. Now, you might be thinking, I eat oranges, I drink orange juice, I should be fine. But here's the issue. Vitamin C is water soluble, which means your body doesn't store it. You need a consistent daily intake, and absorption drops as you age. On top of that, stress, smoking, certain medications, and even high blood sugar levels deplete vitamin C faster than normal. So even if you're eating some vitamin C rich foods, it might not be enough to keep your levels optimal. Next is one that directly affects how stiff your arteries become. Number 5 is vitamin E. People think it's optional, something nice to have but not essential. That's not true. Vitamin E protects the endothelium, which is the inner lining of your blood vessels. That lining is only one cell thick, but it controls everything. It regulates blood flow, prevents clots, manages inflammation, and signals vessels to dilate or constrict based on what your body needs. Damage to that lining is one of the earliest signs of cardiovascular problems, and it directly affects circulation to your legs. Vitamin E is a fat soluble antioxidant, which means it protects cell membranes from oxidative damage. The endothelial cells are constantly exposed to reactive oxygen species from normal metabolism, and without adequate vitamin E, those cells get damaged. Once damaged, they can't function properly. They release inflammatory signals, they become sticky and attract clotting factors, and they lose their ability to produce nitric oxide, which is the molecule that tells vessels to relax. All of that adds up to poor circulation, especially to the extremities. I've seen this in patients over and over. They come in with cold feet, weak pulses in their ankles, and a general sense that their legs just don't feel right. Blood work shows low vitamin E, and when we correct it, circulation improves. Feet get warmer, pulses get stronger, and people report feeling more energy in their legs. It's not dramatic or immediate, but over weeks to months, the difference is noticeable. The challenge with vitamin E is that most people don't get enough from food alone. The richest sources are nuts, seeds, and certain oils, but you need a fair amount to meet optimal levels. And just like with vitamin C, absorption declines with age. There's also the issue of balance. Vitamin E works best when it's part of a complete antioxidant system that includes vitamin C, selenium, and other nutrients. Taking vitamin E in isolation without addressing the rest of the system is less effective. Now we're moving into structural protection. Vitamin K2 is number 4, and this one surprises people. Most assume K2 is only about bone health, but it does something critical for circulation. It prevents calcium from hardening your arteries. Without K2, calcium that should be in your bones ends up in your artery walls, making them stiff. Stiff arteries make it harder for blood to reach your legs with every heartbeat. This is a silent problem. You don't feel it happening, but it's one of the main reasons people develop cold legs and weak circulation as they age. Let me explain how this works. Your body has proteins that control where calcium goes. One of those proteins is called matrix GLA protein, and it keeps calcium out of soft tissues like arteries. But matrix GLA protein only works if it's activated by vitamin K2. Without enough K2, the protein stays inactive and calcium deposits in places it shouldn't be. Over time, those deposits turn into calcified plaques that stiffen the artery walls. Stiff arteries can't expand properly, which means less blood flow, especially to areas far from the heart like your legs. This process is called arterial calcification, and it's incredibly common. Studies using CT scans have found that most people over 50 have some degree of arterial calcification, and the extent of it correlates directly with vitamin K2 status. People with adequate K2 have less calcification and better arterial flexibility. People with low K2 have more calcification and stiffer vessels. The difference shows up in how well blood reaches the legs, how strong the pulses are, and how much stamina someone has during physical activity. The problem is that vitamin K2 is rare in the modern diet. It's found in fermented foods like natto, certain cheeses, and egg yolks from pasture raised chickens, but most people don't eat those foods regularly. Vitamin K1, which is in leafy greens, can be partially converted to K2 in the body, but that conversion is inefficient, especially as you age. So even people eating healthy diets can be deficient in K2 without realizing it. I had a patient, a woman in her late 60s, who came in complaining about leg cramps and cold feet. Her cholesterol was normal, her blood pressure was controlled, but she still had poor circulation. We tested her vitamin K2 levels and found they were very low. After 6 months of supplementation, her symptoms improved significantly. Her feet were warmer, the cramping stopped, and she had more endurance when walking. She told me she wished someone had explained this to her years earlier. Next, we shift into something you can actually feel. Up to now, we've been talking about maintenance, about protecting what you have. But now we're getting into nutrients that people notice. This is where the changes become real. Number three is vitamin B3, also called niacin. B3 directly increases blood flow. Some people feel a warmth or slight flushing when they take it, and that's circulation returning to areas that weren't getting enough. Clinical studies show that niacin improves oxygen delivery to leg muscles, and people report feeling the difference within weeks. The mistake is using high doses without guidance, which can cause unnecessary side effects. Niacin works by triggering the release of prostaglandins, which are signaling molecules that cause blood vessels to dilate. When you take niacin, especially in higher doses, those vessels open up, blood flow increases, and you feel warmth spreading through your body. That's not a side effect, that's the mechanism working. For people with poor circulation, that increased flow means more oxygen and nutrients reaching tissues that have been starved for them. The research on niacin and circulation is extensive. Studies have shown that niacin improves walking distance in people with peripheral artery disease, reduces leg pain during activity, and enhances overall vascular function. It also has beneficial effects on cholesterol, raising HDL and lowering triglycerides, which indirectly supports better circulation. The key is using the right dose and the right form. Immediate release niacin causes more flushing, but may be more effective for circulation. Extended release niacin causes less flushing, but can be harder on the liver at high doses. Most people do well with moderate doses of immediate release taken with food. I always tell patients to start low and increase gradually to allow their body to adapt. The flushing can be uncomfortable at first, but it usually subsides after a few weeks as your body adjusts. And for people who have been dealing with cold, tired legs for years, that temporary flushing is a small price to pay for the improvement in circulation and function. Next is the signal that tells your blood vessels to relax and open up. Vitamin D3 is number two. Most people know D3 affects bones and immunity, but here's what they miss. D3 activates nitric oxide production in your blood vessels, and nitric oxide is the signal that tells those vessels to relax and allow more blood through. Low vitamin D means constricted blood flow, which leads to poor balance, muscle weakness, and a higher risk of falls. Correcting vitamin D improves leg strength and stability, especially in older adults. Nitric oxide is one of the most important molecules in your cardiovascular system. It's produced by the endothelial cells lining your blood vessels, and it signals the smooth muscle in the vessel walls to relax. When vessels relax, they widen, resistance drops, and more blood flows through. Vitamin D enhances this process by upregulating the enzyme that produces nitric oxide. Without adequate vitamin D, nitric oxide production falls, vessels stay constricted, and circulation suffers. But vitamin D does more than just support nitric oxide. It also affects muscle function directly. Your muscle cells have vitamin D receptors, and when vitamin D binds to those receptors, it improves muscle contraction strength and coordination. Low vitamin D is associated with muscle weakness, poor balance, and an increased risk of falls. Studies have shown that older adults with low vitamin D are more likely to have slower walking speeds, difficulty standing from a seated position, and problems with balance and coordination. The issue is that vitamin D deficiency is incredibly common. Most people don't get enough sun exposure to produce adequate vitamin D, and very few foods contain meaningful amounts. Even people who spend time outdoors may not produce enough vitamin D if they live at higher latitudes, have darker skin, or use sunscreen consistently. Blood levels of vitamin D tend to be lowest in winter and early spring, which is also when people report the most problems with leg weakness and falls. I recommend that everyone over 50 get their vitamin D levels checked and supplement if needed. The target range for optimal health is higher than what's needed just to prevent bone disease. I aim for levels between 50 and 80 nanograms per milliliter, which usually requires supplementation. And when people correct their vitamin D deficiency, they often notice improvements in leg strength, balance, and overall energy within a few months. And now we get to the most important one. This next vitamin is different from everything we've talked about so far. People often notice changes with this one: warmer feet, less tingling in their toes, a stronger push when they stand up, sometimes within just a few weeks. If you're wondering why your doctor hasn't brought this up, here's the reality. Standard tests often miss functional deficiency. What that means is your levels might look normal on paper, but your body isn't absorbing or using it properly. And absorption declines significantly as you age, even if you're eating well. This isn't about blaming anyone, it's about awareness. Because once you know what to look for, you can do something about it. The number one vitamin is B12. B12 is the foundation of three critical systems in your body: nerve insulation, red blood cell oxygen delivery, and muscle energy production. Without enough B12, your nerves can't maintain their protective coating. Your red blood cells can't carry oxygen efficiently, and your muscles don't get the energy they need to function. Low B12 causes numbness, weakness, a shuffling walk, and balance problems. And here's the part that gets missed all the time. Many people are deficient in B12 without showing anemia, so it never gets flagged on routine blood work. Doctors look for anemia, they don't see it, and they assume B12 is fine. But functional B12 deficiency happens long before anemia shows up. And without adequate B12, nothing else on this list works the way it should. Let me explain why this matters so much. Your nerves are wrapped in a protective layer called myelin, and B12 is essential for maintaining that layer. Myelin works like insulation on an electrical wire. It allows nerve signals to travel quickly and accurately from your brain to your muscles and back. When B12 drops, myelin breaks down, and nerve signals slow or get distorted. That's why people feel tingling, numbness, or a loss of sensation in their feet. The signals aren't getting through properly. At the same time, B12 is needed to produce healthy red blood cells. Red blood cells carry oxygen from your lungs to every tissue in your body. Without enough B12, red blood cell production becomes abnormal. The cells get larger and less efficient at carrying oxygen. Your muscles, including the ones in your legs, don't get the fuel they need. That shows up as weakness, fatigue, and difficulty standing or walking for long periods. You might feel like your legs just don't have the power they used to, and that's because they literally aren't getting enough oxygen. On top of that, B12 plays a role in energy production at the cellular level. Inside every cell, there are structures called mitochondria that generate energy. B12 is part of the process that converts food into usable energy. When it's low, your cells can't produce energy efficiently, and your muscles simply can't generate the power they used to. You feel tired, weak, and unable to sustain physical activity the way you once could. The tricky part is that B12 deficiency develops slowly. It's not like you wake up one day and suddenly can't walk. It's gradual. You start feeling a little more tired. Your balance feels slightly off. You notice numbness in your toes that comes and goes. Most people brush it off as normal aging, but it's not. And because the symptoms are subtle at first, by the time someone realizes something's wrong, the deficiency has been there for months or even years. There's also another problem. Even if you're eating foods rich in B12, like meat, fish, or dairy, that doesn't guarantee you're absorbing it. Absorption happens in the stomach and small intestine, and it requires something called intrinsic factor, which is a protein your stomach produces. Intrinsic factor binds to B12 in your food and carries it across the intestinal wall into your bloodstream. Without intrinsic factor, B12 just passes through your system without being absorbed. As you age, production of intrinsic factor declines. Some people develop an autoimmune condition where their immune system attacks the cells that produce intrinsic factor. That leads to a condition called pernicious anemia, which is a severe form of B12 deficiency. But even without that autoimmune condition, aging alone reduces intrinsic factor production, which means absorption drops. Some medications make the problem worse. Drugs for acid reflux, like proton pump inhibitors and H2 blockers, reduce stomach acid, which is needed to release B12 from food. Metformin, a common diabetes medication, interferes with B12 absorption in the intestines. Certain antibiotics and other medications can also affect B12 levels. So, even if you're eating a perfect diet, if you're on one of these medications, you could still become deficient over time. Certain gut conditions interfere with absorption entirely. Conditions like Crohn's disease, celiac disease, or any surgery that removes part of the stomach or small intestine can drastically reduce B12 absorption. People with these conditions need to be monitored closely and often require B12 injections or high dose oral supplements to maintain adequate levels. That's why testing matters, but it has to be the right kind of test. A standard B12 blood test measures the total amount of B12 in your blood, but it doesn't tell you how much of that is actually usable by your cells. You can have normal B12 levels on a blood test and still be functionally deficient. A better test is methylmalonic acid, or MMA. MMA is a byproduct of metabolism that builds up when your cells aren't getting enough usable B12. If your MMA is elevated, it means you're deficient at the cellular level, even if your B12 blood test looks normal. Another useful test is homocysteine, which also rises when B12 is low. Homocysteine is an amino acid that's normally broken down with the help of B12 and other B vitamins. When B12 is deficient, homocysteine builds up, and high homocysteine is associated with increased risk of cardiovascular disease and cognitive decline. So, checking homocysteine gives you additional information about your B12 status and your overall health risk. But most doctors don't order these tests unless you specifically ask or unless your symptoms are severe. Standard practice is to check B12 and maybe a complete blood count to look for anemia. If those come back normal, the investigation stops. So people go years without realizing they have a problem. And by the time it's finally diagnosed, significant damage has already occurred. Now, here's what happens when you correct B12 deficiency. People report feeling warmth return to their feet, sometimes within 2 to 3 weeks. The tingling and numbness start to reduce. Muscle strength improves, and standing or walking feels less effortful. Balance gets better, which lowers the risk of falls. Energy levels increase, and people feel like they have more stamina throughout the day. These aren't dramatic overnight transformations, but they're real, noticeable improvements that significantly affect quality of life. I've had patients tell me they didn't realize how much they had declined until they started feeling better. One man in his early 70s came to see me because he was having trouble with balance and his feet felt numb most of the time. He thought it was just part of getting older. His standard B12 test was borderline, and his doctor told him it was fine. But I ordered an MMA test and it was elevated, indicating functional deficiency. We started him on B12 injections, and within a month, he told me he could feel the ground again when he walked. The numbness was going away, his balance was improving, and he felt steadier on his feet. He said it was like someone had turned the lights back on. A woman in her mid 60s told me she had stopped going on her evening walks because she didn't trust her balance in low light. She was afraid of tripping or falling. After 3 months of proper B12 supplementation, she was back to her routine. She said her legs felt stronger, her balance was better, and she had the confidence to walk again. These are not rare stories. This happens consistently when the deficiency is identified and addressed properly. But B12 doesn't work in isolation. It works best when the other vitamins we talked about are also in place. Vitamin C keeps your blood vessels flexible so blood can reach your legs. Vitamin E protects the vessel lining so blood flows smoothly. K2 keeps calcium out of your arteries so they stay soft and responsive. B3 opens up circulation and increases oxygen delivery. D3 activates nitric oxide so vessels relax. And B12 ensures your nerves can transmit signals and your muscles can use the oxygen they're getting. They all support each other. That's why I don't focus on just one vitamin. The body is a system, not a collection of isolated parts. If your circulation is poor because your vessels are stiff, more B12 won't fully solve the problem. If your B12 is low but your circulation is strong, you'll still have nerve issues. You need the whole system functioning together. It's like a chain. If one link is weak, the whole thing is compromised. You have to address all the weak links to get the best results. Now, I want to give you a practical challenge. For the next 30 days, pay attention to your legs. Notice how warm or cold your feet feel. Notice your balance when you stand up or walk. Notice if you're hesitating before certain movements. Write it down if that helps. You're not trying to fix anything yet, you're just becoming aware. Because once you're aware, you can make informed decisions about what comes next. At the same time, review what you're eating and whether you're getting these nutrients consistently. Most people aren't. And even if you're eating well, absorption matters as much as intake. That's something worth discussing with a doctor who understands functional nutrition, not just standard lab ranges. Find someone who's willing to look beyond the basic tests and investigate deeper if your symptoms don't match up with what the standard results show. This isn't about taking handfuls of supplements or making drastic changes overnight. It's about understanding what your body actually needs and giving it the support it's been missing. Small, intentional inputs lead to noticeable outcomes. That's how the body works. It doesn't need perfection, it needs consistency and the right resources. You don't have to do everything at once. Start with one or two things, see how your body responds, and build from there. I also want to address something that comes up a lot. People ask why they haven't heard this from their doctor before, and the answer is that medical training focuses heavily on disease treatment, not on optimizing function. Doctors are trained to identify and treat acute problems, infections, injuries, things that need immediate intervention, nutritional deficiencies, especially functional ones that don't show up on standard tests, often fall outside that framework. It's not that doctors don't care, it's that the system isn't set up to catch these things early. Medical school teaches doctors to diagnose disease based on clear criteria. If your test results fall within the normal range, you're considered healthy, even if you're at the low end of normal and experiencing symptoms. The focus is on treating disease, not on preventing decline or optimizing wellness. That's a fundamental limitation of the current healthcare model, and it's why so many people fall through the cracks. On top of that, many doctors simply don't have time. A typical primary care appointment is 15 minutes. That's barely enough time to address the main complaint, review medications, and do a quick physical exam, let alone dig into subtle symptoms like leg fatigue or mild numbness. And if your blood work looks normal, there's no red flag to investigate further. So these issues get missed, not out of negligence, but because the current system has structural limitations that make it difficult to catch these things. That's why you have to be your own advocate. If you're experiencing symptoms, bring them up. Don't wait for your doctor to ask. Be specific about what you're feeling and how it's affecting your life. If standard tests come back normal but you still don't feel right, ask for additional testing. Request an MMA test for B12. Ask about vitamin D levels. Talk about circulation and nerve function. Don't accept vague reassurances if something feels off. You know your body better than anyone else, and if something doesn't feel right, it probably isn't. It's also worth seeking out healthcare providers who take a more functional approach. Not every doctor is trained in functional medicine, but there are practitioners who focus on optimizing health rather than just treating disease. They're more likely to look at the whole picture, consider nutritional factors, and order the right test to get to the root cause of your symptoms. It might take some effort to find the right provider, but it's worth it. Now let's talk about what happens if these deficiencies go unaddressed. Over time, poor circulation and nerve damage become harder to reverse. Muscles that don't get enough oxygen start to atrophy. They shrink and lose strength, and once that happens, rebuilding them takes significant effort. Nerves that lose their protective coating can develop permanent damage. Some nerve damage is reversible if caught early, but if it goes on too long, the damage becomes permanent. Balance problems increase the risk of falls, and falls in older adults often lead to fractures. Hip fractures, in particular, are devastating. They require surgery, long hospital stays, and extended rehabilitation. Many people never fully recover their independence after a hip fracture. Studies show that within a year of a hip fracture, a significant percentage of older adults have died or are living in a nursing home. That's not meant to scare you, it's meant to show you why early action matters. The good news is that the body has an incredible ability to repair itself when given what it needs. Nerves can regenerate, though it happens slowly, about a millimeter per day. Blood vessels can become more flexible when oxidative stress is reduced and inflammation is controlled. Muscles can regain strength with proper nutrition and consistent activity, but that requires the right nutrients, consistent effort, and time. You didn't develop these issues overnight, and you won't reverse them overnight. But with the right approach, meaningful improvement is absolutely possible. I've seen it happen over and over. People who thought their leg problems were just part of getting older, who had resigned themselves to moving slower and feeling weaker, started making small changes and saw real results. Not because of some miracle cure, but because they addressed the actual underlying causes instead of just accepting decline as inevitable. One of my patients, a man in his late 60s, came to me after his wife insisted. He had been having trouble with leg cramps, especially at night, and his balance was getting worse. He figured it was just age and there was nothing to be done. We ran a full panel, and he was deficient in vitamin DK2 and B12. We corrected those deficiencies, and over the next 6 months, his cramps stopped, his balance improved, and he was able to go on longer walks without his legs getting tired. He told me he felt like he had gotten 10 years back. Another patient, a woman in her early 70s, had been dealing with cold feet and numbness for years. Multiple doctors had told her it was poor circulation due to aging, and there wasn't much to be done. But when we tested her nutrient levels, she was low in several key vitamins. We addressed those deficiencies, and within a few months, her feet were warmer, the numbness was reduced, and she felt more stable when walking. She said it was the first time in years she felt like her body was working with her instead of against her. These stories are not exceptions. This is what happens when you identify the root cause and address it properly. The body wants to heal. It wants to function well, but it needs the right support to do that. And that's the mindset shift I want you to make. Decline is not your identity. Your body is responding to what it's been given and what it's been missing. If it's been missing key nutrients for years, of course it's going to struggle. That's not failure. That's biology. And once you understand the biology, you can work with it instead of against it. Your experience, your history, your life, all of that deserves support, not dismissal. You deserve to move with confidence, to feel steady on your feet, to trust your body again. And that starts with understanding what it actually needs. So here's what I want you to take away from this. First, weak legs and poor circulation are not inevitable parts of aging. They're signs that something specific is missing or damaged, and those things can often be corrected. Second, the six vitamins we talked about, vitamin C, vitamin E, vitamin K2, vitamin B3, vitamin D3, and especially vitamin B12, play direct roles in circulation and nerve function. Without them, your body can't maintain the systems that keep your legs strong. Third, standard medical tests don't always catch functional deficiencies, so you have to pay attention to symptoms and advocate for deeper investigation if needed. And fourth, small, consistent changes make a real difference. You don't need to overhaul your entire life. You just need to give your body what it's actually been missing. In the next video, I'm going to explain the one common medication and the one dietary pattern that silently destroy B12 absorption, even in people who are eating all the right foods. Most people have no idea this is happening, and by the time they find out, years of deficiency have already taken a toll. If you're on any medication for acid reflux, or if you follow certain popular diets, you need to see that video. Make sure you're subscribed so you don't miss it. I'll see you there.